a rent increase or something like that, that's personal advocacy. When you advocate to improve the mental health system and it helps everyone get services, you're engaging in policy advocacy. And today's webinar is focused on policy advocacy, using your story with policymakers to advance NAMI's cause, to build better lives for individuals and families who live with mental illness. Why is advocacy so important? It's because everyone with a mental health condition deserves the opportunity for recovery, yet too few people get the care they need. Elected officials respond best to people who live in their district, especially those who take the time to reach out. Because hundreds of bills land on their desk every session, a personal story from their constituent increases the chance that they will take action. Building good relationships with your legislators is important because they make key decisions about laws and budgets that control who can get what type of care for how long and at what cost. So let's look at the valuable role you play as grassroots advocates. Many people hesitate to contact their legislator because they don't feel they have the facts at their fingertips. But according to research, stories that help the listener stand in your shoes are far more powerful than facts and figures. Any lobbyist will tell you that real stories, if brief and sincere, are advocacy gold. They are one of the surest ways to gain support for mental health care and break the stigma of mental health conditions. Keep these thoughts in mind. Your story is always right. Your lived experience has value and meaning. You don't have to have all the answers, just a clear ask. If you think about it, this is very empowering. Your story will have the most impact if it is brief. Legislators are very busy, so aim for a minute or two, or you'll lose them. And I really can't emphasize this enough. I have seen good meetings go awry when advocates get all wrapped up in their story and go on, and you can see that legislators' eyes glaze over and you've lost them. The handout, 7 Steps to Telling Your Story, is a tool to help you give just enough of your personal experience to make the point, no more. We'll go through the steps now. The first step is to introduce yourself, where you are from, and who you represent, in this case, NAMI Iowa. Give your relationship to mental illness, whether you are a peer, a family member, provider, or some combination. And by the way, don't assume the legislator understands the word peer. You might have to explain that. State the issue you'd like to discuss and the position you want the legislator to take, including a bill number if possible, and we will have that for you. The second step is to describe in one sentence what life was like before you or the person you care about got the help you needed. The third step is to talk about what helped, what treatment, person, or program made the difference. Fourth, describe what is going on right now in your life. This helps legislators understand that mental health services can be a good investment. Fifth, transition from your personal story to the problems others face. 6, describe the solution, what will help others like you. Last and more important, make an ask, a specific bill or position you're advocating for. Thank the legislator for hearing your story, then put them on the hook. And this is a technique we actually use called hook, line, and sinker. By asking if you can count on their support or opposition. In this case, we're asking for support. And by the way, this handout was sent to you all by email. If you get a clear yes, thank them for their support. That's pretty simple. If they respond with a no or a vague statement like, I'll consider that, or thank you for telling me, like no answer, thank them for meeting with you and let them know you'd like to serve as a resource on mental health. Regardless of the response, follow up often to build a relationship. This will help you gently shift their opinions. And I can't emphasize that enough. Building the relationship is what's important, because then the next time you approach them with a concern or an ask, they will be much more likely to listen to you. Your handouts include a story practice sheet. Jot a bullet or two in each section and practice with a friend. A few minutes of prep will help you stay focused when the time comes to tell your story to a legislator. Now we're going to walk through the process of making an appointment with your state legislator. It's simple because legislator staff are usually very courteous and helpful, and actually, it's often not the staff, they're called clerks, that do it. It's the legislator themselves. So they often just make their own appointments. Pretty informal in the Iowa legislature. We'd like you to make your own appointment, but if you need help, let us know. The screen is on the website for the Iowa legislature, and you're going to click on Find Your Legislator. On the next screen, you click the zip code tab and enter your 5-digit zip. Oh, okay. Zach is going to take over now.
So I'm going to run you through the steps on the website. So kind of you can follow the link at the bottom of the screen or just write it down, or you can simply say in Google, just type in Find My Legislators Iowa, and this will be the first result that will pop up. So on that website, like Peggy mentioned, it is going to ask you to fill in some of your information to figure out which district you are in and to which representative you have. So when you're on that website, the first option up on the top left here, it's Find Your Legislator. So we're going to click on there, and it gives you a few different options on how you can input your information. I highly recommend just doing it by your address, especially because there can be multiple legislators for a single city. So they are going to search by your address to make sure that you're within each individual district. And this isn't something that we wanted to make sure that we covered, just so you have that capability to figure this out in the future. Just because legislators change all the time with elections, with resignations, with districts being redrawn, this is a very simple way to figure out who your elected officials are. So I'm just typing in the address for the NAMI Iowa office so we can see who is the representative and senator for our area. So when I hit search, it's going to pull up both individuals. I will say that this website sometimes will let in multiple people for your senator and representative. All you have to do is simply hit the refresh screen and it will switch it back to just one for each position. So when you click on each person's name, it's going to give you a lot more information about them as well, including what committees they're on, what bills they have sponsored in the past, and some background information, and also how to access their website if they have one, and their contact info. So this is where you're going to get a phone number and or email to set up your meeting with your legislator next week. One other thing I wanted to show you is going back to the previous screen. Under each senator or representative's name, it will list their district as well. If you click on that link, it's going to take you to a map of their entire district and lay out exactly by what streets and what towns they are set to represent. So this is a helpful tool that you can take a look at and see who in your area also shares your representative with you, and you can utilize them as another voice up at the Capitol, so you can encourage them to join you in any of your advocacy efforts. So this website is pretty simple to use. We actually sent out everybody's legislators contact info a few days ago. So if you did not receive that and you are attending Day on the Hill, let me know and I can get you their contact info. But now I'm going to hand it back over to Peggy.
Okay, so it's really important to let your legislator know that you're coming and try to get an appointment time. And the reason for that is they may say, oh, just call me out, just send a note in, which is fine, except for that can be challenging to find them. Now, if they just don't want to give you an appointment, there's really not too much you can do about it, but really press to try to set up a time to meet, a specific time to meet and location. And it could be, you know, say 2 o'clock, send a note in for me at the House Lounge, but it's even better if they have an office. Not all of them have offices, and I just want to make sure you knew that. The only people who have offices in the Iowa Legislature are committee chairs and leaders. So if they don't fit into that category, they don't have an office. They just have their desk. So don't expect that. But if they do have an office, that is where you would want to try to meet them, because then it's a place and time certain. So just want to emphasize that. It could also be in the cafeteria. It could be anywhere, but try to get that appointment. So with your appointment made and your story in hand, you can bring our policy priorities off the page by helping the legislator understand what it is like to live with a mental health condition. By placing the elected official in your shoes, you begin to build the relationship. Connecting on a personal level is far more important than powering through a bunch of points, because good relationships increase the odds that a legislator will act on your request in the future. The very best way to connect with your legislator is face-to-face when they are back home in their district. And that's why we send out the list of forums every week in my update. Legislators have forums regularly on Fridays and Saturdays during the session. And then a lot of them also have forums during the off session. But they're usually also open to just meeting. They will come to your place of work. They will, you know, meet you wherever. They're usually quite open about that, and that is the single most effective way, because they're not as busy and overwhelmed as they are at the Capitol. But our day on the Hill will be effective, because we're going to have a whole bunch of people at once talking about mental health, and that will be fantastic. So our day on the Hill will be wonderful. The third best, still very effective, is to contact your legislator by mail, email, or phone call. And we just sent out an alert this morning, actually, about some bills that are up this week that we need contacts about. So personalized email or a call, if you have their cell phone, all the better, but you can also call the Senator House switchboard number. It's important to contact them each time an issue comes up about that specific issue, and then just keep building that relationship. Look at your handout, Making Your Case. I'm going to go over 4 tips now, and you can review the rest later. The first tip is to know your issue. Being clear about the issue and the position you want your legislator to take is vital to an effective meeting. Second, know your policymaker. You can build a stronger connection by learning about your elected official before you meet them, if you don't already. A quick web search will tell you what you need to know. For example, these are all citizen legislators, so most of them have other jobs that they do. It might be farmer or teacher or pharmacist, whatever it is. It would be very helpful if you knew that about them, because it helps you to relate to them and what their interests are. The third tip is to plan your visit. Meeting with your policymaker can be intimidating. I understand that, and planning will help you feel more confident. And there are 3 basic roles to keep in mind. The lead starts the conversation, makes the ask, and closes the meeting on a positive note. The messenger lays out the facts and talking points to support the ask. And the storyteller brings the issue off the page by relating personal experience to the issue. If you are visiting a legislator by yourself, you will take on all 3 roles. The last tip bears repeating. Make an ask. Let them know what would help others, such as a bill or increasing the mental health budget, then ask if you can count on their support. To help you see how these tips work, we're going to demonstrate a meeting with a policymaker and 2 constituents. I'll play the senator while Cindy and Zach they're playing Jenny and, is it? John.
John and Jenny.
John and Jenny will be the constituents. While you listen, notice the roles the 2 constituents play and where you hear our tips in action. Then listen for facts and a story highlight. Good morning, everyone. Thank you for coming.
Hello, Senator. I'm John Adams from Spring Valley. We're members of NAMI Springville, part of America's largest grassroots mental health organization, the National Alliance on Mental Illness. We really appreciate your taking the time to meet with us. We know you're very busy.
It's a pleasure to meet you, Senator. I'm Jenny Jones from Springville.
It's a pleasure to have you here. I know, NAMI, you've always done a great job of bringing up mental health issues.
Senator Walker, before we talk about some important issues affecting your constituents who live with mental illness, we'd like you to know that we appreciate your many years of service in our legislature.
Thank you. I've spent 12 years in public office now.
We also appreciate that as a doctor, you value the health of your constituents and have provided important leadership on the Medicaid health plan and health care issues in our state.
Well, I've seen too many people in emergency rooms with issues that could have been prevented for pennies, including a lot of people who needed mental health care.
I'm glad you mentioned that, Senator. We're here because we want to urge you to support mental health services and House Bill 39, the mental health budget. More families than ever are seeking help from our mental health centers, but with budget cuts, people can't get the mental health services they need.
I've always been a supporter of mental health. I was a co-sponsor on NAMI's parity bill, but it's going to be extremely tight budget this year. There are serious revenue shortfalls, and we're still figuring out where we can find savings. We've got to get spending under control.
We understand, Senator. It's going to be challenging, but the people of our state deserve the opportunity to be productive and healthy. To have that opportunity, they need access to mental health care. Also, if we don't protect mental health services, it's going to cost us more in other places. When our children can't get help for mental health conditions, they fall behind in school and families struggle. When adults can't get treatment, costs shift to jails, emergency rooms, and hospitals.
Isn't that the truth? Like that kid involved in that police shooting. They're saying he has a mental illness. I can't believe those parents of his didn't do something before a tragedy happened.
Yes, there's a lot of speculation around that. I just wish the media would talk about stories of recovery, like mine, instead of focusing on the sensational news. I'm here because my life is affected by mental illness. My son Andy lives with a bipolar disorder, and I can tell you that treatment can make a difference between despair and recovery. Today, Andy's living on his own, working as an artist and making me proud. I never thought I'd see him experience this kind of recovery. But it wasn't always that way. Before he got the treatment he needs, I saw him in the back of police cars and held him in my arms after a suicide attempt. No child should have to go through this.
I really appreciate your story, Jenny, and I'm so happy to hear your son is doing well. Is Andy showing his art anywhere?
Yes, the gallery is representing him, but what I'm worried about is that there are thousands of others in our state just like my son, except most don't get the help they need. More than 1 in 10 youth and about 1 in 17 adults lives with a serious mental illness, so it's more common than most people think. Many of our returning servicemen and women are experiencing mental illness too. We need more mental health services, not fewer. It's an investment in health and productivity. If people can get the right care at the right time, they can be successful, just like my son.
The people of our state need your vote to protect mental health care. Can we count on your support of House Bill 39, Senator?
You've both made some excellent points, and I'll keep them in mind. I know how important mental health services are, and I'll think about this as we're working on the budget.
Thank you so much, Senator Walker. We appreciate you taking the time to hear about our issues.
Thanks for meeting with us, Senator. We know your time is limited, so we'd like to leave you with this packet that contains a fact sheet and NAMI's other legislative priorities. We hope we can count on your support for them.
Please know that we'd welcome the opportunity to be a resource to you in the future. We'd also like to follow up and see how you intend to vote on our issues.
Certainly. Please give my clerk your contact information before you leave so that we can get a hold of you.
Well, thank you, Senator. If you have time, we'd be honored if you'd have your picture taken with us for our newsletter.
I think I can take a moment for a picture. And please tell Andy hello from me, will you?
Of course, Senator. Thank you. That'll make his day.
Okay, so thank you for taking the time to build your advocacy skills. By using your story to build a relationship with your legislator, you are helping everyone who lives with mental illness. This is a critical time for mental health services in our state. Your voice can make a real difference. We hope that you're all going to be joining us for our Day on the Hill next Wednesday. And now we're going to open the lines for questions and discussion.
Also, if you haven't registered for Day on the Hill yet, it is not too late. The event page is open until about Tuesday afternoon, just because we have to make material. So we have to put the cutoff point there at that point. So the website to get to the event page, it's pretty simple. It's all is one word, NAMI Iowa Day on the Hill 2018.eventbrite.com. So if anybody has any questions, everyone's been unmuted, so feel free to unmute yourself on your own phone as well and jump in and ask those questions.
Yeah, I guess I have a couple of questions.
Okay, go ahead.
Is there a fact sheet that we will be able to pick up at the Holiday Inn before we go up on the hill?
Well, we have a whole training in the morning. The agenda is on the event page. So registration begins at 9:30, and the training is from 10 to noon. Then we have lunch, and then we have, well, we provide transportation up to the hill.
Okay, so in that training, we're going to talk about current bills that that are in the Senate and the House?
Yes.
Okay, all right, thank you.
Hmm?
I had a question. You said we meet at the Holiday Inn on 6th Avenue, is that correct?
Correct.
And what was the time on that?
Registration opens at 9:30 and we begin our program at 10 a.m.
Okay, all right. And just come in the front lobby area on 6th Avenue?
So there's a parking lot above ground right outside the hotel, and then there's actually another parking lot underneath the first parking lot. And there's an elevator that will connect you to the lobby. So if you want to avoid the wind or if it snows that day, that might be a good option.
Okay, thank you.
Is there going to be plenty of handicap parking spaces?
Yeah, so the Holiday Inn has handicap spaces at the front of their parking lot.
Okay, thank you.
Other questions?
Peggy, we did have one question from the chat box that I wasn't able to get to.
Okay.
It's from Carrie. She asks, what if we can't get a meeting with a legislator? Are there other things? Oh, Carrie, I'll follow up with you if you need to leave early so we can connect on that one.
Just because you can't get a meeting with your legislator, and remember, you've got your representative and your senator, so you should be meeting with at least 2 legislators. And, you know, feel free to meet with more. Some people do. But you can definitely, even if you can't get an appointment, you can try to find them and call them out with a note. Well, how to do that. And if for some reason you can't make Day on the Hill, we're going to, excuse me, I'm going to be providing tips on contacting your legislator in advance, and then also after the event to follow up. Like, sorry, I couldn't be there, I couldn't make it, but I wanted to follow up with you about the issues that we're talking about. Because we've had several people who, for whatever reason, can't make it, but they still want to make a contact with their legislator, and that's great.
So I guess being Wednesday's a week away, it wouldn't be beneficial to send a letter through the mail as opposed to email, because email we know gets there faster.
Right. Yeah, I wouldn't try to send a letter through the mail at this point.
Okay. All right, because I already wrote to the federal representatives, Grassley, Joni Ernst and David Young.
Uh-huh.
And I've written to Cled Balder before, but I didn't know about Jake Chapman, who's the senator. So
Uh-huh.
I will contact his office to see where his stand is on this.
Great. Anyone else?
Peggy, could you talk a little bit about people potentially going in groups to meet with their legislators?
Right. So we've been asked about this, that, you know, there's strength in numbers, right? And so we're going to try to put people together who are from the same area. And I think we'll maybe try to do that actually in the room. But yeah, we're going to. Zach is nodding. Okay. And put people together who are in the same district so that you can go together to talk with your legislators.
And I think Zach said something before about a pamphlet that we were supposed to get that they sent out through an email.
Well, we did. Zach, you want to talk about what you sent in advance of this webinar?
Yeah, so we kind of did the legwork a little bit for you. So we sent out everybody's, based off the addresses you provided when you registered for Day on the Hill, we looked up who your legislators are, and we sent that out in an email.
Well, I didn't get it, but I already know who my representatives are.
Okay, and for anyone else, if you did not get that email, let me know, and I can resend that to you.
Zach at NAMIIowa.org.
Okay, Zach, this is Sharon Brown. I didn't receive an email on that, so I'd certainly appreciate one.
I will add you to the list.
Thank you, Zach.
And we'll just say that, you know, if any other questions or concerns come to you between now and next Wednesday, and you need help finding your legislator or how to connect or on any of the issues, please just let us know. We want you to feel prepared and confident.
All right.
So you can enjoy the day.
Yeah.
Now, are you going to have speakers there at the Holiday Inn, or is it just going to be NAMI personnel?
We are going to have speakers.
Okay.
I encourage you to go to the event site and take a
The details aren't on there.
Oh, they aren't. Okay. We are going to have speakers. We probably should send the agenda out to people so they have it.
Okay.
But we're going to have a couple of people who are experts on the patient protection bills that we're working on. We're going to have Rick Schultz from the Department of Human Services and Sheriff Jason Sandholt talking about the complex needs legislation. And we're going to have Tammy Knighton, who is an expert on the children's mental health system, talking about the kids' issues. And then we'll also be having a little session on how to lobby, some of the same stuff that we covered on the webinar.
Okay.
All right.
No, I found this through Joan Becker. I had reached out for her because we were at our wit's end, my wife and I. We've been dealing with this since our son's been 14 and he is now 36. And to be perfectly honest with you, I've committed him 7 times in the last 10 years. And it seems like a revolving door.
Wow, we're sorry to hear that.
And it's killing my wife.
Oh.
And no matter what we do, it's just not good enough.
Oh.
And I've reached out for senators and congressmen, and I've never, ever got a response.
Wow. That is unfortunate. Well, I'm glad that you got hooked up to NAMI Iowa, and hopefully we can allow you to use your voice on behalf of our issues, because this complex needs bill that was just introduced yesterday, we get this passed and we make sure that it's all implemented, it is really going to improve the mental health service in Iowa, really significantly. I'm very excited about it.
Well, I don't think we have it.
Excuse me, I just wanted to say, Zach, could you email me that link for the legislators?
Sure. Can I ask who's speaking?
Oh, I'm sorry. This is Royce Stockton.
I've got you on the list.
Thank you.
I want to thank you for this webinar. This has been very interesting. Thank you very, very much.
You're welcome. Glad you could join us.
And we have actually been recording this webinar, and we're going to upload it this afternoon. So if you want to come back and review any portion of it, or if you want to share it with other people that you know might be interested in this information, it will be accessible to all. And I'll be sending that out in a link this afternoon once it's uploaded.
Oh, wonderful. Thank you. Thank you.
Is that also going to go on your Facebook page?
We'll have a link in a post on Facebook that will take you to the video.
Well, thank you everybody for joining us, and we hope to see you next Wednesday.
All right.
Thank you very much. I really appreciate it.
Thank you.
Thank you.
All right, thank you.
You.